So when patients ask about skin tightening devices, which ones work and which ones don't?
Okay, so when they're talking about skin tightening devices, they're usually talking about either Body Tight or Renuvion, which is the J plasma device. Both of those use some type of heat underneath the skin when after you've done liposuction, and the idea is that that heat is delivered and it helps to contract or tighten the skin and the connective tissue. So some people get really good results with that. I don't personally use them because for me, it's really an uncontrolled burn underneath the skin. You're delivering all this heat and all this energy. And while that might help to stimulate some contraction of the skin, you could also burn the lymphatics. And everyone's so concerned about lymph sparing lipo, but then they'll also use these energy delivering devices. And you don't know how much that you're cooking the lymphatics, you don't know how much fibrosis you're going to create. So for me, in my hands, I don't think that they add anything. They certainly scare me enough to where I don't want to use them and cause unnecessary burns or unnecessary harm. But some people get really good results, so I would say talk with your surgeon and see what they recommend about using a skin tightening device. I would ask them if they have any complications with it, if they've ever had any burns with it, do they think that it's absolutely necessary? And then for me, the best skin tightening procedure is really going to be an excisional skin tightening procedure. To some degree, when you do liposuction, it will allow the skin to be less heavy and to retract a little bit. But for some patients that have poor elasticity of the skin, then you're going to need some type of excisional skin tightening procedure like an arm lift or a thigh lift or a tummy tuck to get the results that you want.
Okay. So is there anything in particular that you do recommend for skin tightening?
I think some of the most important things, at least a patient can do, is using their compression garments after surgery. If you have a nice uniform compression all the way from your immediate afterwards until about 3 months later, that can help the skin retract more uniformly and keep some of the edema out for when it remodels. But ultimately, if you're going to need a skin removal procedure, you're probably going to know that ahead of time, and that's something that we'll plan for. But in terms of something that the patients can do or a device that I use, I pretty much stick to just doing the liposuction and then a skin excision procedure afterwards.
Okay.